Health officials will meet on Wednesday to review applications for the first COVID-19 vaccines for children under the age of 5. Here to answer your questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. We always love to see you, doctor. Thank you.
Great to see you, Dr. Moffatt. So the FDA
Hi.
plans to review 2 vaccines at this meeting. One is from Pfizer and the other is from Moderna. Will regulators have the same questions about both of them, do you think?
Yes, they will. I mean, they'll be really carefully evaluating both the safety data and then the immune response data for both of these studies, the one from Pfizer and the one from Moderna. Both companies have released a little bit of data, too, around the efficacy of these vaccines in these studies at preventing symptomatic infection. But I think regulators will need to really carefully consider whether or not those represent a similar amount of time from when the subjects had finished their vaccine series. So I'm not sure comparing those numbers will be able to be done head-to-head, but more to come.
Got it.
Doctor, both vaccines use that same mRNA technology, but the dosing here is different. So what can you tell us about that?
Yeah, that's right. So the Pfizer dose for this age group will be a 3 microgram dose, which is 1/10 of the adult Pfizer dose. And it's given as a 3-dose series spread over about a 3-month time frame. The Moderna vaccine for this group is a 25 microgram dose. So that's a quarter of the adult Moderna dose given as 2 doses 28 days apart.
So, Dr. Moffatt, as you know, parents could have to make a choice if both vaccines are authorized. So based on what you know, and again, it's what you know right now, obviously, can you think of a reason why you might recommend one over the other?
Yeah, exactly as you say, too, Ed. Not yet at this point. We haven't seen the original data. But once the original data are reviewed, if indeed they both look similarly safe, and if indeed they both look like they have a similarly successful immune response that's generated in these children, then I think parents and families may be basing their decision on some really practical factors. One may be around timing. One vaccine series will take about 2 months less to complete than the other. So if they're really eager to get their child fully vaccinated right away, that may sway their decision. Another practical factor is what's available. Doctors' offices, pediatricians' offices, pharmacies may only offer one and not the other. So we'll need some more information to make those decisions.
Nationally, parents have been reluctant to vaccinate kids in the 5 to 11-year range. So do you think that they'll have even less interest in vaccinating their babies and toddlers based on that?
Yeah, I think it's possible. I think parents there is a trend towards even more reluctance or hesitation towards any sort of an intervention as children get even younger and younger and into the infancy age. National polls currently suggest that only about 20 to 25% of parents of children in this age range are going to get their child vaccinated right away. But an even larger percent have said that they are going to consider vaccination once there's just some more experience and safety data around using these vaccines in this age group. And that's definitely been the trend in every age group when these vaccines have rolled out so far. And I expect we'll see that trend in these very young children too.
Dr. Moffatt, thank you for your time. It's great to see you.
Sure. Thanks for having me.
Thanks, doctor. Stay well. And to our viewers, if you have COVID-related questions that you would like our experts to answer, just email them to ask@wcvb.com.